Hello, I'm Ryan Liberty, and this is the Mental Health Breakdown for the week of April 3rd to April 9th, 2017. On Tuesday, April 4th, Idaho Governor C.L. Butch Otter passed a law that allowed clinical psychologists to prescribe medication. The American Psychological Association reported on this the following day. APA President Antonio E. Puente, Ph.D., commented, "Access to appropriate mental health treatment is important throughout the United States, but it is particularly critical in Idaho due to a shortage of psychiatrists, long waiting times, and high suicide rate." According to the law, advanced specialized training is required before a psychologist can begin prescribing medication. In 2015, the suicide rate in Idaho was 57% greater than the national average, according to the Idaho Department of Health and Welfare. According to reports collected by the Idaho Psychological Association, wait times to see a psychiatrist in the northern Idaho area can take up to 1 year, and wait times in the Boise area are frequently 2 to 3 months. Allowing psychologists to prescribe medication will improve access to needed mental health services. Idaho joins New Mexico, Louisiana, Illinois, and Iowa in allowing psychologists to prescribe medication. On Wednesday, April 5th, The Guardian published an article entitled, "What Can the UK Learn from Finland's Approach to Mental Health?" The article talks about Finland's Mental Hub, an online provider of mental health information, services, support, and treatment. Finland's Mental Hub was created 10 years ago in response to fragmented mental health services by Professor Grigory Joffe and Dr. Matti Haaly at Helsinki University Central Hospital. According to HUS Director of Strategy Dr. Visa Honkanen, preliminary evidence shows that the therapy provided works as well as therapy that is provided more traditionally in face-to-face settings. The services provided through Mental Hub are cheaper than traditional treatments, and professionals who are looking to provide therapy can take on a larger caseload of patients than under traditional models. On Thursday, April 6th, the American Psychological Association announced a special edition of their journal, American Psychologist, in which they asked the question, why do some with radical views become terrorists, yet others don't? Articles found in this special edition include Understanding Political Radicalization, the Two Pyramids Model, Risk Assessment and the Prevention of Radicalization from Nonviolence into Terrorism, Building Community Resilience to Violent Extremism Through Genuine Partnerships, Toward a Psychology of Humiliation in Asymmetric Conflict, There and Back Again, the Study of Mental Disorder and Terrorist Involvement, Revenge versus Rapport, Interrogation, Terrorism, and Torture. Some questions that this special edition of American Psychologist focus on are, since most people who hold radical views do not become terrorists, what are the factors that drive some to violent extremism? Is there a connection between mental illness and terrorist involvement? And why do some interrogators resort to torture when the body of evidence shows building rapport with suspects is more effective? Friday, April 7th, the World Health Organization celebrated World Health Day, this year's theme, depression. World Health Day is celebrated every April 7th to mark the anniversary of the founding of the World Health Organization. World Health Day is the focus of a year-long campaign around depression called Let's Talk. The central theme around Let's Talk is that depression can be treated. The first step is talking. Dr. Shekhar Saxena, director of the Department of Mental Health and Substance Abuse for the World Health Organization, talked about the campaign. He said, "The continuing stigma associated with mental illness was the reason why we decided to name our campaign Depression Let's Talk. For someone living with depression, talking to a person they trust is often the first step towards treatment and recovery." According to the World Health Organization, depression is the leading cause of ill health and disability worldwide. More than 300 million people are now living with depression, an increase of more than 18% between 2005 and 2015. Support for the campaign could be seen across social media as people like Amina J. Mohammed, Deputy Secretary General of the United Nations, tweeted out, "Let's talk about depression and ensure access to quality mental health for everyone, especially women and children in conflict. Hashtag World Health Day." Actress Lana Parrilla, best known for her role on Once Upon a Time as Regina the Evil Queen, tweeted out, "Depression can affect anyone. On World Health Day, make sure those affected know that depression is preventable and treatable. Hashtag Let's Talk." The World Health Organization has released a video where you can learn about depression. They also did a Q&A on depression with Dr. Shekhar Saxena, Director of the Department of Mental Health and Substance Abuse for the World Health Organization. It features blogger Joe Irwin of Heads Together and the Lady London, and it also features Remy Barb, acting head of medicine at Malatavi Crisis Unit. Since this is a yearly campaign that began on October 10th, please continue to use the hashtag Let's Talk on social media to learn about and spread awareness of depression. On Saturday, April 8th, The Mighty released an article honoring poets who put mental health in the spotlight. The topics these poets jam on include OCD, bipolar disorder, eating disorders, depression, borderline personality disorder, and PTSD. As Sarah Schuster, staff writer for The Mighty, says, they say out loud words we're used to hearing in whispers and give us permission to tell our own stories, however we chose to. And finally, for some upcoming news, Sunday, April 16th is Project Semicolon Day. According to Project Semicolon's Facebook page, on April 16, 2017, everyone who is feeling suicidal, struggling with mental illness, living with anxiety or unhappiness, self-harming, surviving a broken heart, or learning to live without a loved one, post a picture of your semicolon, whether it's drawn on your arm or tattooed. We want to see it. Project Semicolon was started by Amy Bluell, who recently died by suicide on Friday, March 24th at the age of 31. Project Semicolon is a nonprofit dedicated to giving hope and love to those who are suffering with depression, suicide, addiction, and self-injury. In the words of founder Amy Bluell, a semicolon is used when an author could have ended their sentence but chose not to. The author is you, and the sentence is your life. Project Semicolon launched on April 16, 2013 on social media. Project Semicolon Day marks the anniversary of Project Semicolon's founding. And that concludes your mental health breakdown for the week of April 3rd to April 9th, 2017. Please subscribe to get further updates.